Hospitals in Rhode Island are seeing an increased number of kids being diagnosed with a respiratory virus. It's usually seen only in the winter months.
The virus, known as RSV, can cause at-risk people who become infected to wind up in the hospital. Target 12 investigator Sarah Gurnelli spoke with a local expert and joins us now live in studio with more.
A doctor at Hasbro Children's Hospital tells me they normally start seeing kids with RSV from November to March. But there has been a surge in cases in Florida, and now more infections are showing up here in Rhode Island. Experts say about 1 million kids every year wind up in the hospital because of RSV. It's a virus that infects the lungs and breathing passages. For most people who get infected, it's like the common cold. But the virus can be serious for those under the age of 2 and the elderly.
The amount of RSV in New England is definitely increasing right now.
Dr. Michael Koster, a pediatric infectious disease specialist at Hasbro Children's Hospital, says typically cases of RSV happen in the winter months. He says it's out of the ordinary that cases are popping up in the summertime, some kids even becoming hospitalized.
You know, in the last few months, maybe we've had a dozen cases of RSV and bronchiolitis. We might have anywhere from 30 to 40 kids with bronchiolitis on any given day in the wintertime.
Although Dr. Koster says it's unclear exactly what is causing the jump in cases, he believes the pandemic is partly to blame.
It has something to do with COVID because COVID essentially competitively took over the market of people's noses, right? And so we didn't see anything like flu or RSV or anything like that. We have tests now that often include things like influenza and RSV in that test for COVID. So that's why we're also seeing a bit more of it than we traditionally might see this time of year because we typically wouldn't be testing for it.
He says if there's a surge in RSV cases this winter, that could mean trouble for the hospitals who are also dealing with the new COVID-19 variant. Dr. Koster says the best way to prevent spreading RSV is to, of course, wash your hands and cover your mouth when coughing. With the Target 12 investigator, Sarah Gurnelli, 12 News.